The week of July 14th to 18 on The Bold and the Beautiful plunges viewers into an emotional whirlwind, where hospital walls echo with urgent decisions, unspoken confessions, and the haunting tick of borrowed time. At the center of it all stands Liam Spencer, Scott Clifton, bruised, bloodied, and fighting for his life. After a violent gunshot wound sends shockwaves through the Forrester and Spencer families. Rushed into emergency surgery, Liam's fate now hangs in the balance. But while every second counts, a tense power struggle erupts in the operating room. Dr. Grace Buckingham, Cassandra Creech, is determined to take the lead. Liam isn't just another patient to her. He's become a symbol, a mission, an obsession. Despite the presence of other pressing cases, like Sheila Carter, Kimberlyn Brown, awaiting her own urgent procedure, Grace won't back down. Dr. John Finn Finnegan, Tanner Novlin, finds himself torn. With Sheila's condition teetering on the edge and Liam's life slipping away, he makes a risky call. He'll tend to Liam while pushing Grace to handle Sheila, but nothing in the hospital that night follows protocol. Liam's heart rate drops. His brain tumor, long a silent specter in his life, complicates everything. Steffy Forrester watches in horror as her former love's body is wheeled past her. For months she sensed something was wrong. Liam was never the same, tired, distant, distracted. Now the truth she feared is crashing down. He's not just fighting for survival. He's fighting a battle that might never end. And Grace, she's not just operating on Liam, she's operating on hope. To understand the current storm engulfing the halls of the hospital, we need to go back to the quiet tremors that signaled something more dangerous beneath the surface. Liam Spencer didn't become a critical patient overnight. His journey here is a culmination of months of silence, pain, and denial, all hidden behind a strained smile and eyes that had lost their spark. It began with the headaches, small, persistent. Then came the fatigue, the memory lapses. Steffy noticed first, as ex-wives often do, the flicker of confusion in Liam's face, the pauses in his speech, the tremble in his hands. But Liam brushed it all off. He had no time for doctors, and even less for diagnoses. Not with his father, Bill Spencer, Don Diamond, pulling him back into the corporate grind. Not with tensions high between Steffy and Hope Logan, and certainly not with the specter of Sheila Carter threatening their world once again. But then something snapped. A confrontation with Luna Nozawa, Lisa Yamada, escalated into violence no one saw coming. The details are still murky, conflicting witness statements, high emotions, blurred motives, but one thing is clear: a gun was fired, and Liam was hit. Not once, but twice. The second bullet tore through his side as chaos erupted around him. Finn was among the first to arrive on the scene. His hands, usually steady, shook as he called for the ambulance. The shock was palpable. Not just because Liam had been shot, but because of what the X-rays revealed once he was brought in. Buried deep in Liam's brain was a tumor, undetected and, more importantly, inoperable. For Finn, this changed everything. Removing the bullets would be risky enough, but with a brain tumor in the equation, every choice could spell disaster. Anesthesia complications, brain swelling, post-op trauma. Enter Grace Buckingham. Her arrival was unexpected. Once a skilled and respected surgeon, Grace had taken a back seat in recent months, but upon seeing Liam's name on the patient board, she pushed her way in, citing previous consultations. She claimed Liam had been her patient before, though no one could confirm it. Her passion was undeniable, bordering on desperate. She demanded to lead the surgery. Finn refused, at first. But fate and a second emergency with Sheila forced his hand. Now the staff watches anxiously as two operating rooms prepare simultaneously, one for the infamous Sheila Carter, the other for the broken body of a man who once stood at the heart of Los Angeles' most complicated love stories. A man now defined not by romance, but by a deadly condition that may have been eating away at him longer than anyone realized. The past has led us here, to white corridors, bloodied scrubs, and whispered prayers. But the real question looms large. Is Liam's battle just beginning or already lost? The double doors of the emergency room burst open with a familiar sense of chaos, but this time it felt different. The stakes weren't just high, they were personal. Liam Spencer was rolled in, pale and bleeding, surrounded by a team of medical professionals trying to remain calm while knowing the gravity of the case. Every beep of the heart monitor echoed like a countdown. Every second ticked closer to the unthinkable. In the middle of it all stood Dr. Grace Buckingham, gloves on, mind racing, heart pounding. She wasn't just another surgeon. To her, Liam wasn't just another trauma case. She saw in him a ticking time bomb, not just from the gunshot wounds, but from the undiagnosed brain tumor she had discovered months ago and had quietly tracked without fully revealing to the rest of the hospital staff. Finn entered the room like a storm. He had just come from Sheila's pre-op consult and was torn between two impossible choices: saving the woman he hated or saving the man everyone loved, a man with a medical history riddled with secrets. "We don't have time for protocol," Finn snapped, grabbing the lead surgeon chart. "He's crashing, now." But Grace stood her ground. "I know his tumor. I know what anesthesia will do. Let me take this." Finn hesitated, just long enough to feel the weight of his indecision. There was no right answer here, only risk mitigation, and the hospital board wouldn't look kindly on a surgeon prioritizing family, or enemies, over standard assignment. Sheila's case needed his hands. Liam's might need Grace's. In the tense minutes that followed, they made a compromise. Finn would stabilize Liam and remove the bullet from his lower abdomen. Grace would monitor cranial pressure and step in if the tumor interfered. But no one was comfortable, least of all Steffi, who watched helplessly from behind the OR glass as the two doctors clashed in whispers and glances. The surgery was brutal. Blood loss surged. Liam's oxygen dropped. For a moment, Finn thought they had lost him. The beeping flatlined, just for seconds, but to everyone watching, it felt like hours. Grace took over chest compressions. Her hands moved methodically, but her eyes told a different story. A woman desperate not just to save a life, but to prove something. To herself, to Finn, to the ghosts of patients she couldn't save before. And then, a pulse. Weak but steady. Liam had made it through the initial surgery, barely. But the danger was far from over. Finn stepped out into the hallway, scrubs soaked, face gray. Steffi rushed forward. "Is he?" "He's alive, for now." Inside the room, Grace was already prepping charts for the next phase. Craniological scans, tumor response, and a highly controversial treatment proposal. She wasn't done, not even close. While others celebrated survival, Grace looked ahead to what came next. Another surgery, another gamble, another shot in the dark. And all the while, Sheila Carter was still waiting. Just as the surgical team sighed with relief after stabilizing Liam, the cold, hard reality returned. A reality that no scalpel or stitch could fix. Liam Spencer was no ordinary trauma case. Beneath the bandages and sutures, inside the brain that had guided his every decision, lay something far more sinister than any bullet wound. A tumor. It was non-operable. It was aggressive. And worst of all, it had been there for months, quietly, lethally growing inside him. Dr. Grace Buckingham had known. Not all the details, perhaps, but enough. Enough to push for early tests, to suggest treatment paths, to urge Liam to act before it was too late. But Liam, ever the peacekeeper, the fixer, the man who put others first, had hesitated. His priorities had been his daughter, his relationships, his corporate role, and now time might no longer be on his side. Post-op scans revealed the tumor's expansion. Grace pored over the charts like a woman possessed. Chemotherapy, she insisted. Radiation immediately, every hour counted. Every delay brought the threat of seizures, cognitive decline, and eventual fatality. She prepared proposals, made calls, and drafted emergency authorizations. But John Finnegan disagreed. To him, rushing into an aggressive treatment regimen mere hours after a major surgery could be reckless. Liam's body was already weakened, his immune system compromised. The gunshot trauma alone would take weeks to fully recover from, if he ever did. Layering radiation and chemotherapy on top of that might break him completely. Steffi stood at the center of the storm, caught between two doctors, one a skilled physician and loving husband, the other a woman who claimed to understand Liam on a deeper, almost intuitive level. Grace's passion was undeniable, but at times it felt unhinged. She referenced notes no one remembered authorizing. She spoke of a connection to Liam that made even Bill Spencer raise an eyebrow. Finn confronted her privately. "Is this about saving Liam or saving yourself?" Grace didn't answer, not directly. Her eyes welled, but her voice remained firm. "You saw the scans. You know what that tumor will do. We wait. He dies." Later, by Liam's bedside, Steffi gently pressed her hand to his. "They want to fight for you," she whispered. but only you can decide how hard we push. And therein lay the core dilemma. Liam's consent, his will to fight, his hope if any remained. He hadn't woken up since the surgery, but his fate now hinged on what he'd choose. More pain for a slim chance at time, or peace with the risk of leaving everything and everyone behind. Grace watched from the doorway, fists clenched. For her, this wasn't over. Not yet. Outside the sterile walls of the operating room, life didn't stop. It shattered. As Liam lay unconscious, hooked up to machines that hummed and blinked, his loved ones gathered in the hallway, each processing the crisis in their own way. The silence wasn't peaceful. It was suffocating. Bill Spencer, Don Dumont, was the first to break it. Not with words, but with fury. He slammed his fist into the hospital wall, teeth clenched. "He should have told me," he growled, voice raw. "I'm his father. I should have known." His rage wasn't just at the world. It was at himself. The signs were there. Liam's increasing fatigue, his uncharacteristic mistakes, the way he rubbed his temples like trying to squeeze clarity from a foggy mind. But Bill, ever the alpha, had dismissed it as stress, overwork, family drama, not cancer. Steffi Forrester, Jacqueline McInnes Wood, was a ghost in her own skin. Her eyes were red-rimmed, her hands trembling as she gripped a paper cup of untouched coffee. She had once loved Liam deeply. A part of her still did. They had shared a child, a history, a lifetime of complicated moments. Now she couldn't stop thinking about the last time they spoke, the tension in his voice, the way he avoided eye contact. "If I had just pushed harder," she whispered to herself. Nearby, Brooke Logan and Hope Spencer sat in silence, both struggling to process the enormity of the situation. Hope, in particular, was shattered. Liam had been her partner, her co-parent, her safety net. Now he was a patient on the edge of life and death. Her mind raced with thoughts of Beth, their daughter, and how she'd explain this to her if the worst happened. "She's going to ask where he is," Hope murmured to Brooke, who could only nod and swallow the lump rising in her throat. Then there was Thomas Forrester, standing slightly apart, observing everything. He wasn't Liam's biggest fan, but even he looked shaken. For all their rivalry, Liam had always been steady, someone who did the right thing, even when it hurt. And now, that man might be slipping away. Meanwhile, Dr. Finn delivered the updates with clinical calm. But Steffi saw through it. She knew him too well. The weight was crushing him. The pressure to save Liam, the guilt of sending Grace in, the knowledge that this was more than just medicine now. And in the midst of this emotional hurricane, the hospital corridors pulsed with a singular question. What if Liam doesn't wake up? For all their strength, their power, and their money, not a single one of them could answer that. While the hospital's surgical wing braced under the weight of Liam's critical condition, trouble brewed just a few rooms away. If Liam was the heart of this week's tragedy, then Sheila Carter and Luna Nozawa were the shadows lurking at the edge, quietly sowing chaos. Sheila, even confined to a gurney, was far from helpless. Having suffered her own emergency that night, she awaited surgery, but made it clear to the staff that she would not be delayed, not even for Liam. "I've paid my dues," she snapped at a young nurse. "I have rights and I expect them to be honored." Her eyes, cold, calculating, never left Finn's whenever he entered the room. Her presence was like poison in the air. A reminder that danger wears many faces, not all of them bleeding. But what did Sheila really want? Her injury, according to Finn, was non-life-threatening. A deep laceration, a cracked rib, nothing urgent. And yet she demanded priority, demanded his full attention. Some whispered that she staged the entire incident, that it was a distraction, a trap, even a manipulation to pull Finn away from Liam and force him into emotional chaos. And if that weren't enough, Luna Nozawa's involvement was becoming increasingly complicated. What started as a confrontation, loud voices, a struggle, a gunshot, now revealed deeper layers. Luna hadn't meant to hurt Liam. That's what she told herself. But the gun had gone off during her argument with him. Some staff reported seeing her hands tremble in the waiting area. Others overheard her muttering, "It wasn't supposed to happen like this." What was supposed to happen? Grace, for one, had questions, pointed ones. She had worked with Luna before and noticed the inconsistencies in her behavior. "You're not telling us everything," she warned. "And if you're hiding something, Liam could pay the price for it." There's a growing sense that Luna's motives aren't as clean as they seemed. Was she defending herself or covering something up? As Liam sleeps under sedation, the walls around him whisper truths he may never hear, and the deeper those around him dig, the more dangerous those truths become. Because in the bold and the beautiful, secrets always surface, and they rarely do so quietly. Liam Spencer survived surgery, barely. But in the bold and the beautiful, survival is never the end of the story. It's only the beginning of a far more complex and painful journey. And as Liam lies motionless in a hospital bed, the ripple effects of what happened in that operating room begin to wash over his life like a rising tide. The tumor remains. Though the gunshot wounds were stabilized and the bleeding controlled, the underlying crisis, a deadly, inoperable brain tumor, continues to threaten his life. Dr. Grace Buckingham has already drafted an aggressive post-op treatment plan. She's calling for a combination of radiation and experimental chemotherapy, starting almost immediately. Time, she insists, is the one thing Liam no longer has. But John Finn Finnegan pushes back. He knows what Grace is suggesting might kill Liam faster than the tumor would. After major trauma, the body needs rest. Pushing treatment too soon could trigger seizures, organ failure, or worse. Caught in the middle is Steffi, who refuses to leave Liam's side. Her mind is haunted by what-ifs. What if he wakes up confused? What if he doesn't recognize her? What if in some cruel twist, the Liam they once knew is already gone? Then there's Bill Spencer, who's already meeting with specialists behind closed doors, ready to move heaven and earth, or break hospital rules, to give his son a second chance. Money isn't the issue, he told Finn. Tell me what to buy, who to fly in, what clinic to shut down. I don't care. Just save him. And what of Grace? Her behavior is drawing scrutiny. Some staff have begun to question her obsession, her insistence on performing Liam's surgeries, her refusal to rotate out for rest, her unblinking stare at the monitors. Even Finn, though grateful for her skill, has started to wonder, is this still about medicine or something more personal? One theory gaining traction among fans and fans is that Grace may have a secret connection to Liam that no one knows about. A case file from years ago. A misdiagnosed episode. A vow to protect him at all costs after a past failure. Whatever it is, her determination is bordering on reckless. And the tension is mounting. If Liam wakes up, and that's still an if, he won't be returning to the life he left. He'll be walking into a storm of questions, medical decisions, and relationships twisted by fear and desperation. And just beyond his hospital door, Sheila Carter watches and waits. A wild card in a game that's already spiraling out of control. In the bold and the beautiful, nothing stays buried forever. Just as Liam Spencer's loved ones begin to breathe again after his surgery, new storm clouds gather. And this time, they're darker, more personal, and far more unpredictable. First, there's the question no one dares to ask aloud. Is Liam being written out? Fans online are buzzing with speculation. The combination of a life-threatening shooting and a terminal brain tumor feels final, too final. Has the show been slowly building toward Liam's exit? Or is this just a clever misdirection before a miraculous comeback? But even if Liam survives long-term, he won't be the same man. His memory may falter, his mood may shift, and depending on the tumor's pressure on specific brain regions, he may even experience personality changes. Could the bold and the beautiful be laying the groundwork for a darker version of Liam, one capable of betrayal, secrets, or even revenge? Then there's Grace Buckingham, who's gone from determined professional to emotionally entangled enigma. Whispers in the hospital suggest she may have known Liam long before he entered her operating room. Is it possible Liam was once her patient as a child? Or worse, a biological connection no one ever suspected? Sheila Carter, meanwhile, is far too quiet. For someone known for chaos, her passivity is unsettling. Why is she so calm? Why isn't she demanding to leave or threatening lawsuits? Some believe she's waiting for Finn to make a mistake, one she can exploit to turn the tables on everyone, including Steffi. And Luna Nozawa, she's keeping something back. Whether it's guilt or intent, she's not telling the whole story about that gun. And now, with Liam unconscious, he can't defend her or accuse her. What happens if he wakes up and tells a very different version of the events? One final twist looms over all of this: a return. Rumors are swirling that a former character may come back, someone from Liam's past with unfinished business. Could it be Wyatt, Ivy, or perhaps Hope will turn down a new path of desperation? reaching out to someone dangerous for answers or a cure. Whatever happens next, one thing is certain: no one is safe. Not in love, not in medicine, not in truth. Because in this world, the moment you think the danger has passed is when it strikes again. As the bold and the beautiful storyline surrounding Liam's shooting and tumor diagnosis unfolds, fans have taken to the internet in waves, flooding forums, comment sections, and social media feeds, with reactions ranging from emotional heartbreak to wild speculation. On Reddit's R Soap Operas thread, one user wrote, "This might be Liam's most layered storyline in years. If this is his swan song, they're going out with a bang, literally." Others are less convinced that Liam is on his way out. "It's a fake out," wrote another. "They'll miraculously cure the tumor with a secret Forrester-funded treatment. Just watch." Meanwhile, Grace Buckingham is a hot topic. A number of fans believe her behavior suggests something more personal than professional. One theory gaining traction: Grace could be Liam's biological mother, separated at birth under mysterious circumstances. Far-fetched? Maybe. But this is B&B. Anything is possible. As for Sheila Carter, the consensus is clear. She's too calm, she's got something planned, probably using this hospital chaos to slip out undetected. And Luna? Half the fandom thinks she pulled the trigger intentionally. The other half thinks she's covering for someone else entirely. In true soap fashion, nothing is what it seems, and everyone has something to hide. The halls of the hospital may quiet down, but in The Bold and the Beautiful, silence is never peace. It's the calm before the next emotional explosion. Liam Spencer has survived the unthinkable, but ahead of him lies a brutal road paved with invasive treatments, personal revelations, and shifting loyalties. The tumor in his brain is no longer just a medical crisis. It's a narrative catalyst, one that will test his relationships, challenge his identity, and force those around him to choose between loyalty and survival. Steffi, Hope, Bill, Finn all stand on the edge of a cliff, watching Liam teeter between recovery and collapse. And then there's Grace, whose motivations may soon face the harshest scrutiny. What drives her obsession? What lines is she willing to cross to save Liam? Meanwhile, secrets linger in Luna's silence, and Sheila Carter still breathes, biding her time like a serpent coiled beneath the surface. This summer, The Bold and the Beautiful promises a storm of truth, betrayal, and heartbreak. So buckle up, because just when you think the danger is over, it begins again. Thank you for joining us for this emotional preview of The Bold and the Beautiful. If you're as hooked as we are, don't forget to like, comment, and subscribe to stay updated on every twist, betrayal, and shocking return. Hello and goodbye.